name is Amra Šakušić and I am an internal medicine resident from Bosnia. As a Fulbrighter, I came to do the research for my PhD thesis at Mayo Clinic. One of our aims was to explore potentially modifiable risk factors for long-term cognitive impairment after critical illness. It has been noticed that a significant number of patients that are admitted to the ICU actually end up being cognitively impaired. The incidence of cognitive impairment after critical illness varies across the study from 4% to 64%. An estimated financial burden per year is 18 billion. So, this makes it clear that it is very important to work in this field. We wanted to summarize everything that has been known so far regarding potentially modifiable risk factors that contribute to development of cognitive impairment after critical illness. We screened 3,180 articles. And among those many articles, we identified 28 studies that met our inclusion criterion. Interestingly, those studies had quite a small sample of patients and the results were inconsistent. But the strongest associated risk factors that was actually associated with developing cognitive impairment after critical illness was delirium. So, among 9 studies that identified and explored the influence of delirium on long-term cognitive impairment, 6 of them reported it as independent risk factors that play a significant role in developing cognitive impairment. Other potentially modifiable risk factors that showed weaker association with developing long-term cognitive impairment were hypoglycemia, hyperglycemia, and fluctuations in glucose level. While mechanical ventilation, length of ICU stay were not associated with the developing long-term cognitive impairment in the majority of studies. But what's the most interesting is that all of those studies had quite a lot of limitations, like small sample of the patients, then different, there were no study that were looking into broad spectrum of potentially modifiable risk factors, but rather 1 or 2. So this is telling us that there are more things that has to be done in this field. So what we wanted to explore actually is we did the original research on thousands of patients who were admitted in the critical care to explore a broad spectrum of potentially modifiable risk factors using unique definition of cognitive impairment. Majority of studies published so far didn't have the information regarding the baseline cognitive function while admitting patients to the ICU, which is a huge limitation. We used the data from the Mayo Clinic study of aging as a sensitivity analysis actually to confirm and recheck the baseline cognitive functioning of patients while being admitted to the ICU. It is important that we identify potentially modifiable risk factors during the ICU that play a significant role in developing long-term cognitive impairment in order to figure out and create preventive strategies so that we can decrease this devastating complication of critical care illness and make the quality of life of our patients after the ICU better.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.